So, prynhawn da poib, croeso I cyfarfod heddiw, welcome to this May's meeting of Heathier Merthyr Tydfil Scrutiny Committee. Please note that this meeting may be recorded and broadcast via the authority's internet site. The images and sound recording may also be used for training purposes. I'll formally go through the agenda, although I've asked about apologies. Any apologies, Jane?
No apologies received.
No. Okay, thank you. I'd like to welcome Nick Corrigan to his first meeting of Heathier Merthyr Tydfil. Welcome, Nick, and thanks for joining us as a co-opted member of this committee. I hope you'll enjoy your time sitting on it. Okay, item number 2 are declarations of interest. Okay, if we move to item 3, action logs. There aren't any actions outstanding from previous meetings. If we could then move to item number 4, which are the minutes of the meeting held on the 24th of March. I'm not sure who was present. Jane, have you got it? Would someone move and second, please?
I moved, Chair.
Yeah, I think I'll have to second, Councillor Hughes. I think Julia was present. Was it present, Claire?
Yeah, Claire was there.
Yeah.
Yeah, a second.
Yeah, okay.
Thank you, Chair.
Thank you very much. Now, before we continue with the agenda, I have had a request from officers to swap the items around. So if we could first deal, if members agree that is, if we can agree with item number 6 next, and then move on to item number 5. Are members in agreement with that suggestion or request?
Yeah.
Okay.
Yes, Chair.
Yeah. Okay. I don't know if Louise, are you presenting, outlining the report, Louise, or is it being taken by one of the officers?
No, I'm happy to, Chair, if that's okay. If officers are okay with that. Yeah, bear with me. Okay, so agenda item 6 is overview of adult and children's mental health services, Chair. Yeah.
Yes, that's right.
Okay, lovely. So this report provides members an overview of adult and children's mental health services across Merthyr Tydfil, including current provision, progress since previous reports, and key challenges in the system. So full detail is provided within the report on the background papers. Since Scrutiny last considered this area, there has been positive system development, a shift from more fragmented services to a more integrated partnership approach across Cwmtaf Morgannwg region, strong progress in prevention and early intervention, which is now embedded across the system. A range of community, school-based and third sector services are supporting people earlier, helping to reduce escalation into specialist services. We've also seen improvements in partnership working and clearer pathways, particularly for children and young people, with the NEST frameworks, and that's alongside the stronger no wrong door approach. In addition, co-production is now well established, with services increasingly shaped by lived experiences. The report highlights ongoing challenges, including rising demand and pressure on specialist services, capacity and issues around access, thresholds and waiting times. Looking ahead, there's clear strategic direction through the national and regional work, with a focus on continuing to build a more integrated, accessible and preventative systems. In summary, there has been progress, but continued focus will need to respond to increasing demand and complexity. So moving to the recommendations is 2.1. Members will receive information ranging from primary mental health services, secondary mental health services, and the responsibilities of partner agencies in the delivery of such provision. It is intended to support strategic understanding, scrutiny, and partnership working across health, social care, and the voluntary sector. Thank you, Chair.
Thank you. Thank you, Louise. do any of the officers want to come in at this stage, please? I think we've got Alex online, Alison and Elisa. I'm not sure if Suzanne is in relation to this report or the other one.
No, Suzanne is the other report. No, I
Yes.
think Councillor Richards, we're happy to take any questions. I think Louise gave a good overview of the report.
Yeah. And it is a very comprehensive report to us as the other one, isn't it?
Yeah, I mean, I suppose what we were conscious of, I should say, is that it was a big document. So if there was anything specific you wanted moving forward
Yes.
about
Yeah.
a particular area, but we've tried to cover all areas of mental health, from prevention to statutory, across children and adults. So I appreciate there's probably not huge detail in some areas, it's just a snapshot, but obviously Alison's on from an adult point of view, and Alex, and then I'll do my best in Joe's absence to do the children's stuff.
Yeah. Thank you very much, Lisa. First of all, we move to questions, and members, got any questions, please? Councillor Claire Jones?
Thank you, Chair. Let me just bring up my mod.gov. Thank you. Sorry, it's... There it is. My first question is 5.2. How do we ensure every individual in secondary service is an allocated care coordinator? What are we looking at the current ratio for patient coordinator, please?
Shall I take that question, Councillor
Yes, certainly.
Richards?
Yes.
So
certainly.
5.2, any individual under the mental health measure has to have an allocated care coordinator, and whether that be a social worker or whether that be a community psychiatric nurse. So they all have to have that, and a care and treatment plan is co-produced of them. We wouldn't be in statutory compliance if we did not have a care coordinator. And where there are any areas of escalation, there's an appropriate escalation policy through the local authority and the health board, because the health board and the local authority are responsible for appointing a care coordinator. So Councillor Jones, in fairness, we comply in terms of care coordination, and we are then measured through the Mental Health Act Monitoring Committee in terms of coordination around the CTP plan and the review of that. So in answer to your question, we comply, and then we are probably around, well, Alison can come in. I can see Alison has got a hand up. She'd probably be more, the workings of it. So Alison, do you want to come in there if I haven't covered the compliance?
No, you've covered it comprehensively, Alex. I just had the figures now. In Merthyr, we've got 163 people in secondary care who are care coordinated, and that does include our forensic colleagues in CPNs. And as Alex said, that's CPNs, care coordinators. It can be OTs and social workers. Our operational policy states that when somebody's accepted into secondary care, they call then the measure refers to the person as got the word now. Sorry, and within a month, our policy says they have to be care coordinated. So everybody who is accepted in, a relevant person, sorry.
Yeah.
I had it on the tip of my tongue. A relevant person. So once they accepted in, we have 4 weeks in which to allocate. The only times we don't, if there is severe staff shortages, and if that is the issue, we complete what we call an unmet needs.
Right.
So we escalate that. I would escalate it to Rob, who would escalate it to Alex, and we got the same system in health. And then senior management would be looking, what are we doing to make sure these individuals are allocated?
That's lovely, Alison. Thank you ever so much both. I know it was a bit of a bizarre question, because I know we've got the social workers, but it was Alison. I think it was you I was looking for the answer, and thank you ever so much. You gave it very well, so thank you.
Thank you.
I have then You know, on 5.4, where we've got the people who become close to secondary mental health services within 3 years, and it states then that they enables a quick reassess. With the individuals, are they given like a booklet or something with their rights on, so they know what their rights are, or is it just verbally given?
Do you want me to take this one, Alex?
Yeah, I'm happy for you to, Alison. I was going to start answering, but you're in a better position for
Thank
me.
you, Alison.
It's my first time here, like if I'm taking over, sorry guys. No, when somebody is discharged from secondary mental health services, they are sent a letter, and as you say, it gives them the rights under part 3 of the measure. So that is where people can re-refer. The idea behind it is you haven't got to go to your GP, so if somebody's relapsing, they got quick access back in. So it's part of our prevention to prevent further deterioration. They can ring up, they can go to 111, which is a new service, #2, which has been really successful. So anybody who's having a mental health issues can ring them, but we would encourage people. We know a lot of the people who are discharged, so our duty officers would be more than happy to speak to that individual, and often the care coordinator who once worked with them would speak to them because we've got that relationship. So it's a quick access. We'd get them back within a week to reassess them and offer support. It's an assessment, it is. It don't mean they'll come in for care coordination, but their needs would be assessed. But they do have it in writing when they discharge. There is a booklet, so they got the numbers and everything, so they can phone back quickly.
Thank you, Alison. I think this next question, if you don't mind, Chair, would be addressed to you as well, Alison, if you don't mind. Because in 5.6... Can I just interject
a second, Claire, a minute?
Sorry?
Just to explain to Councillor Thomas has joined us now. We've moved the reports around, Ian. We're on the mental health report, okay?
Right, okay. Thank you, Chair.
Thank you, Claire.
Technical issues trying to get in.
Sorry, Chair. I've gone to 5.6 now, Alison. I'm going to say Alison because you seem to be answered all the questions. You know, with 5.6, with the where it says that it's multidisciplinary with a range of support. Do the families then have a single point of contact, or are there numerous? Do you know what I mean? Because when you say multidisciplinary, there's different people there. So have they got that one person that they can just rely on?
It's the one number. So we've co-located, so there's not different numbers for social workers, nurses. It is the one number. There's a duty officer on from 9 to 5, and they accept calls from families. I mean, with GDPR, sometimes we can't share information, but we certainly can take information, particularly if a family's got a concern of somebody relapsing or a risk. So we'll take information. If the person has agreed to share information, which every year we get individuals then to update their consent to share, and we ask them who they're happy for us to share information, we're able to share information, especially when there's risk issues. But it's the one number, the CMHT. Or if they're not open to us, it's 111 #2 for any other inquiries. They're all triaged then by qualified staff. And then they put them then, if it's the crisis team, if it's an assessment within 24 or 4 hours, it's the crisis. Within 72 hours, it's the CMHT.
Thank you. Chair, I've got a few more because I've gone down the line now. I'm on to children.
Yeah.
Is that okay?
Yeah. Can perhaps Councillor Hughes come in
yes,
then and then come back to you, Claire? Is that right?
By all means.
Okay.
Thank you, Chair.
Councillor Hughes.
First time we've ever been given away, Claire, but there you are. Thank you. This is for Alison again. Alison, sorry you put you on the spot. With information sharing, have we got the same system between health and social care, or are they different systems?
The same system, because our health colleagues in the CMHT use WICIS, so they use the same system. So we are we are using the same system. The same consent to share form is given to individuals who work with CPNs, psychiatrists, social workers. We are really well integrated and use the same system. We've got information sharing leaflets, so we can share them with the individuals if they're not sure about what they consenting to. So, you know, we go through it with them. We don't just have them to sign. We explain, you know, and it's updated annually, which is really important because people may change their mind who they want to share information with.
That's good news, because I know that health and social care has different systems for other parts of the health and social care. So it's good to hear that. Thank you.
We're quite unique in the CMHT, and hopefully our colleagues will come on the new system when we go over to the new system.
Lovely. Thank you, Anne.
Back to Councillor Claire Jones, Councillor House, finished?
Thank you.
Yeah.
Thank you, Chair.
No problem there.
Can I go to 5.14, please? How does the essential partnership role work, please? It's under the Children and Adolescent Mental Health Services, Merthyr Tydfil.
Sorry, Claire, so I was just reading it. So there's
Sorry, I seem to have somebody outside my window screaming for steel and iron.
It's the new windows. Oh, there you are. As if I was saved by magic, Joe's just joined the meeting. So Joe is Councillor Jones is referring to 5.14 in the report around CAM services and what the essential partnership role is.
Sorry, I'm trying to get my .gov to work. 5.14.
Yeah, please.
Sorry. It's taking me a while to try and find the So say the question again. Sorry, Councillor Jones. I'm sounding very incompetent today. Apologies.
No, that's fine.
Right, I found it. So the regional partnership working across Cwmtach Morgannwg, yeah?
Yes.
And what the partnership is.
Yes, I was just asking, how does the essential partnership, how does it work?
So the regional partnership, it's between Bridgend, RCT and Merthyr Tudful, obviously. So it's within health professionals are part of that, education, you know, those are involved in the regional partnership. So under that, then the regional partnership is the children's board for the children's side, which is chaired by Lisa. And then from that, we'll look into sort of the grants from the Regional Capital Fund, the grants from the Regional Integration Fund. So it looks into things like the grants and allocations we put in through bids for that. And from that, remember the presentation you had on the whole system, whole heart? So regional partnership. So under that, then there's different working groups. So I chair, for example, the emotional wellbeing group as part of that. And I also chair the complex needs and transition group. And under those, we've got some work streams now we're developing to look into how we transition between adult and children's services within health, you know, and different work streams under that. So we're all integrated, but it all comes from that whole system, whole heart strategy, which was shared previously.
Okay, thank you, Joe. 5.15, when you're talking about the effectiveness of the early help education based, how are we monitoring that? To see whether to see whether it's working, you know, and how we're monitoring how people go in there and things like that. So, because mild to moderate needs are usually supported through early help, education-based support, primary care, and the voluntary sector. So, are there figures around that, or have I missed it? Sorry. Thank you, Chair.
Okay, was that 5.15? Did you say?
Yeah.
Sorry, Councillor Jones.
Thank you.
So there's data that comes through. So locally, we'll look into our data. We have a quality assurance framework which looks into the quality of the data, that, you know, the quality of the information that comes in. We sort of look into then the outcomes. Are we got value for money, and we sort of review us. You know, so internally we do that work, and then across the region, there will be reports that look into certain, those areas. So, like I said, so we're looking at emotional well-being. So we have the local assessments that we gather the data from the local assessments that need to be undertaken, and we utilise that data to find the areas of needs. They do things like hackathons, so they sort of take not just the quantitative, the qualitative data as well. And then people can bring in areas of needs that they think developed, and we have discussions about whether we need a work stream looking into those. We're getting a bit big, so we've sort of started to streamline the areas that we're looking into to make sure that we're really looking into the priority ones rather than sort of an issue that might be from one area. It needs to be, looking at the regional issues across, like what we say about transition, complex needs, that emotional well-being, making sure. So, data comes from all sort of, sometimes we'll ask to share data on our children with disabilities. So we'll share that data so we can look and see if there's a need. Perhaps House has raised, but that we need a support in a certain area. So we'll all bring our data to see whether it correlates and evidences that need. If it does, then we might take that forward. If it doesn't, then we'd say our evidence doesn't support what you're saying. Does that make sense? So we sort of get it from lots of places.
Yeah, that's lovely. Thanks, Jo. Really appreciate it. Chair, I've got one final question. Is that okay, or would you like to go to somebody else first?
If it's your final one, we'll stick with you,
Yes, my final question. I don't know who would like to answer this, because I think it would go for both. It's 5.19, which is going, sorry, my mod.gov is going everywhere. It's the AMHPs are responsible for considering all requests made for the Mental Health Act assessment. My question is, what happens if we've got the dual diagnosis then? There's a physical health and a mental health, and perhaps a DOL audit is in place.
I've come in to take that question, but Alison is our CMHT manager, but a Mental Health Act assessment will apply to anybody who requires a Mental Health Act assessment, whether they're under deprivation of liberty safeguards or whether they're physically, it's in regards to their mental health. People can have co-occurring issues, but the assessment is purely based upon their mental health, and the statutory responsibility lies with the local authority. And the AMP service, which, Alison, if you want any further support details around that, we manage that on behalf of the local authority and the CMHT, and the AMP assessments are coordinated by the CMHT. And so if there's an indication that a person requires an AMHP assessment, then they will be reviewed and assessed and identified whether there is a need for that assessment to continue. But they have to be approved by a doctor as well. We can't just go out. There's clear criteria and clear legal framework for our AMHPs, and our AMHPs are responsible for that assessment and responsible for the detention, but also as well they are supported by a range of services which will enable that person to have a thorough assessment. We always look for the least restrictive option because it's really important that we do that, because to be detained under the Mental Health Act is significant for somebody. So the least restrictive option is always looked at. But yes, Councillor Jones, if there's a dual diagnosis, it's around their mental health, and we will always assess.
Lovely. Thank you very much, Alex. That's really appreciated. Thank you, Chair.
Thank you, Councillor Claire Jones. Councillor Ian Thomas, please.
Thank you, Chair. I've just got a general question around dementia. How much priority is given to dementia when a person is discharged to home if they are living alone? And if their dementia is severe, do they need 24/7 supervision? And where does this come from? And then secondary to that, I was going to ask what percentage of dementia sufferers do not have a carer? And what is your response to that?
If I take that one first, In terms of those individuals living with dementia, a number of individuals living with dementia do live at home with a package of care to support them, and some don't. Some have their main carers that are unable to support them. When we undertake assessments, if it is indicated that individuals are struggling to maintain their independence living at home, then we undertake an assessment under the Social Services and Wellbeing Act, and we identify whether there is a need to increase the package of care in the first instance, or whether we need to be looking at alternative care such as residential EMI or nursing care. And that is again is done through a multidisciplinary approach, Councillor Thomas. So it's always involved the individual, their family, as long as obviously there are no concerns and people are acting in individual's best interest, and any decisions that are made are undertaken through a best interest process. In terms of your last question, Councillor Thomas, in relation to the data, could you just repeat that, please? Because we probably will have to go away and find that data for you.
Oh, well, I was just asking really to get an idea of what percentage of dementia sufferers do not have a carer. And then sort of what is the extra response to this?
So if an individual who is a diagnosis of dementia doesn't have a main carer, as in somebody who was identified as their carer, we would look to see what package of care. We would probably need to run a report to identify if there were any individuals who didn't have a main carer recorded on their file as such. I'd have to check to see if we can gather that data, but we do offer carers assessments, Councillor Thomas, and we probably would be able to find that information for you, but it wouldn't be to hand at this moment in time, only because it's not something that is readily available to myself.
Right, thank you, Alex, very much.
Okay.
Thank you, Chair. That's all.
Any other members got any questions? I've just got a few because the report, as I said, is quite comprehensive. In paragraph 4.3, there's reference, I believe, to a wide range of third sector organisations involved in this area. Just for the record, really, and for the recording, could some examples be given, please, of what third sector organisations are involved?
Chair, before we have examples of those third sector organisations, obviously because we know I need to declare an interest in relation to a third sector organisation, but I am able to speak and vote in relation to that one, just in case that one is mentioned.
Yeah.
But
okay.
just to put it on there.
So, and speaking from a Cwmtaf Morgannwg area, the regional commissioning unit do commission a range of services such as mental health matters, and also some of our more local ones such as our voluntary action Merthyr Tydfil. Sorry, I only know them as VAMT, but we commission a number. We don't necessarily commission a number of wellbeing services. They are undertaken by health as well, but we do have a range of voluntary services that we can signpost to. I don't want to put Alison on the spot, but she may know of those more to hand than I actually do, so I apologise for that from a Merthyr perspective. Alison, are you able to just give a couple of examples for me, please?
Mind is is the main one, and Cwmtaf contract with Mind to provide services through what you may have heard of the Recovery College. So it's quite broad services. Mental health matters, as Alex said, we can contract with them, we can spot purchase. And VAMT, Sharon Jones, we work very closely with. She's the an officer that has service users to be included in meetings, and when we have our Have You Say Day, Sharon is a part of that, and the last one we had was actually at VAMT, and it was well attended by third sector. So Mind, I would say, is one of the main organisations that are contracted, but it's through Cwmtaf Morgannwg Health Board. But because we're an integrated team, we can access the services, and our service users can access Recovery College.
Yeah, thank you, Alison. Before I ask some further questions, my apologies, Julia, I didn't see you on your hand up, so I'll call you next?
Mine was a comment, sorry. I thought you were making a comment. So mine is a comment as well.
You're first on the comments list, okay?
Excuse me, Councillor Richards, sorry, I don't want to interrupt you, but if you recall, I did provide members with a background to recovery colleges from a last scrutiny, so I can resend that if you would like that information as an attachment to this report,
yeah, okay,
which gives you a little bit more info on recovery colleges.
Yeah. Thank you, Alex. Moving on to paragraph 15.4, I think Claire touched on it, but it's a different aspect, really. It's regarding the CAM service. Sometimes I've come across a number of instances of criticism of services. Whilst I appreciate it's delivered by the Health Board, could you explain your experience of working with them, please?
Yeah, certainly. So I think there's been massive improvements in the last sort of 2.5, nearly 3 years that I've been here with CAMS that I've seen. We've improved our working relationship. So we had, I don't know if you recall, joint inspection with HEIW, Health Inspector of Wales and CNW, and they came to Merthyr Tydfil as part of that and did an inspection, and we've had to come up with an action plan, so a regional action plan. So they did this across Wales. As part of that, we really developed our working relationships, and it's just been a real positive change. So we brought in things like our complex needs panel. So someone from health comes along to that, and we look into our children who are looked after, perhaps have some complexities. How do we solve some of the challenges to make sure we're referring in the right areas? And we also, as part of that, have children who are on Educare. So when I first brought that in, 2 years ago, probably now, there were a number of young people who were part of being discussed at that, and that's reduced massively because I think it's developed our working relationships. So I think sometimes the frustrations were we didn't kind of understand the role of CAMS and got CAMS and the sort of LD, so learning difficulties and the neurodiverse a bit confused and thought that CAMS dealt with all these areas, if that makes sense, and we were sort of referring to the wrong areas. Waiting lists have come down for CAMS. There was quite a huge waiting list that's come down for the ND, the neurodiverse areas, that's come down as well, although still quite high. So I think sometimes it's a confusion about who they work, who's working, what team does what. So I attended the CAMS team meetings. They've presented someone to attend ours to explain some of the roles. We meet regularly. We become much more involved. We've also developed, although it's going to change the name to CTM Connect, what's called Space Wellbeing. We're developing with CAMS, so a CAMS worker will be sat within our early help hubs, so we can sort of triage really early, so we can understand get in there before they reach CAMS's level, if that makes sense. Just to make sure the supports are going in the right level. So I would say huge change. We have MDT, so multidisciplinary meetings with CAMS for some of our more complex young people. Some of them we have on a weekly basis with them. We're sharing information better. There will always be individual cases where we disagree, perhaps, on threshold, because we want support that goes in and it doesn't meet their threshold, which is why we have complex needs panels, so we can kind of really talk on an individual case basis, so we understand each other's reasoning, and we might not then agree, but we come out with agreed routes out.
Okay.
So yeah, I'd say much improved, but I can only talk for the ones that are involved with our services. Yeah. Again, parents might come to you who aren't involved with children's services and have a different view.
Thank you very much. Councillor Hughes?
Hello, Joe. You can put your camera back on. Question for you. Have we got a mental health nurse working within children's services now?
So CAMS do come and sit in with our supporting change team and our early help, so they do come in, and like I said, with the Space Wellbeing, or CTM Connect as it's going to be called, that CAMS worker will be based within our early help hub to signpost and direct people, so that a permanent,
that's good.
Yeah, so that's coming in. So they've appointed the person, and they, in fact, they're in place now. So they're been in the office, so they are there now.
That's good news. Thank you.
Okay. One further question is in relation to paragraph 17. What is the extent of the quarter protection work? Is it quite high volume, or is it occasionally?
Thank you, Councillor Richards. I'll
Alex?
take this
Yeah.
one because it comes under all of adult social care. So we've seen an ongoing increase in the applications that are made to the quarter protection in relation to adults over the age of 18 who lack capacity. The reason behind this is because of the fact that there's a number of restrictions that some people are finding themselves in, and also they're disputing their level of care. So we have seen a significant increase. I can get the numbers for you. However, one thing that I do want to mention is that we should actually be applying to the COP, to the quarter protection for these particular cases, because of the levels of restrictions that people will be under, unfortunately. We need to make sure that we've got a legal framework in place in regards to those individuals. Dependent on, obviously, if they do go into a registered care home or a nursing home, then a deprivation of liberty safeguards could be applied. But we do have quite a significant waiting list for those individuals to have a DOLS order. And also, if there is significant dispute from family members, the individual or any other parties, then we will go through the quarter protection framework. And indeed, sometimes our advocates who are appointed under the DOLS framework will request that there's a welfare order undertaken as well, which we will do. They are a lengthy process and quite timely because of the level of evidence that has to be provided to the court and to the judge who is ultimately making a decision about that person's care moving forward. So I suppose in answer to your question, Councillor Richards, yes, they are increasing, and I envisage that they will increase year on year due to the complexity of the individuals that we are now supporting.
Yeah, I thought possibly that was the case, Alex. That's why I raised it. And then my final question is in relation to paragraph 520. Could someone briefly go through the various sections and orders that are referred to there, please? Because it shows quite significant level of work.
So, Alison, if you've got the report to hand, this is the different levels of assessments under the Mental Health Act assessment that was provided.
Yeah.
So there's a range of those. So, Alison, I don't know, we've obviously put these in, but do you want to talk through those for me?
You've given the stats, haven't you, Alex? I think the stats they are collated by our Mental Health Act administrators. So you've got the Merthyr stats, and obviously they cover RCT. So at the very beginning, I think it was a question that Councillor Claire Jones asked as well. Somebody would make a referral, or they'd ring up the AMP and have a discussion where they feel possibly a Mental Health Act assessment is required. So we would ask the person to make a referral because we'd want to know what else has been tried, because we wouldn't go straight in to undertake an assessment. We'd look at all alternatives first. So the most common section is section 2. Section 2 is an assessment, detention for a period of assessment, and is up to 28 days. So the person comes into hospital and then the hospital assess that individual. Lots of things can happen within the 28 days. People can recover, they can be discharged home with discharge planning. For some individuals who require treatment under the Act, the consultant on the ward would ask for a assessment for section 3. So section 3 is for treatment, and that is up to 6 months. If somebody's been detained on a section 3, they would then be eligible for what we call section 117 aftercare. And that means all services being provided to that individual for their mental health would be free of charge. We've also got section 4. We use this very, very rarely because to undertake an assessment, you have to have 2 doctors, One needs to be Section 12 approved, so a psychiatrist, and another doctor could be GP and an AMP. So the application is founded on 2 medical recommendations, and sometimes the AMP won't make an application. So 2 doctors are saying this person has got a mental health, you know, a mental disorder, but the AMP may try and look at other alternatives and say, well, we'll try this first. So a Section 4 is used when we can't possibly get 2 doctors, because we do have terrible trouble. There is a national shortage of Section 12 approved doctors. So sometimes, very, very rare, we can use a Section 4, which would require 1 doctor and an AMP. The person then goes into hospital, and within 24 hours, another Section 12 would come and assess that individual. You have Section 7, which is guardianship. We haven't got anyone under guardianship at the moment. And then under Part 3 of the Act are all the forensic sections, and they are usually used by the courts. Section 37, 37, 41, and they are for restricted patients, we call them. And very often those are the patients that the Ministry of Justice have a say in it. So the AMPs very often are social supervisors, and we have to write reports to the Ministry of Justice to say how the person is getting on, are there any risks, and sometimes those individuals can be recalled by the MOJ. So it's very, very varied, but the answer is Section 2 mainly, Section 3, and very, very rarely Section 4.
Thank you very much. Much appreciated. Any further questions then before we move on to comments? Okay, any comments, please? Councillor Claire Jones, and then Councillor Julia Jenkins, then Councillor David Hughes.
Thank you, Chair. I just want to welcome Alison, because Alison, well done on answering all the questions. I think we've thrown quite a lot at you, and you've just been on point when you're answering them. So first I'd like to welcome you, and second I'd like to say thank you for answering all the questions in the manner you did. And thirdly, I'd like to thank you all for a very good and thorough paper. So thank you ever so much. Thank you, Chair.
Thank you, Councillor Jenkins.
Mine's quite a lengthy one. I've written it down. Is that okay?
Yes, fine.
Right. Okay. And it's combined with the 2 reports. It is because they're relevant to both anyway. But it's obvious in both reports that the essential services of prevention and early intervention has again proved a major factor to the positive and progressive outcomes in both. In relation to dementia care, with the Dementia Regional Integrated Fund, such a high demand for dementia diagnosis was, as you stated, 1,063 referrals between 2024 and 25. Unfortunately for many, the waiting period is too long, and the medical treatment that's available is only successful at very early intervention. And I think people's awareness and that help and support can be accessed is obviously is easier to find now than it was maybe 5-10 years ago, but it's a factor of this access and of doctors' appointments as well. The lack of doctors' appointments to get this process in action, because a high level of dementia care now, because there's so many dementia patients in the community, a lot of the patients are relying on charities to care for them. And then we go to the suicide prevention and self-harm. Unless you're actually hit by it, I don't think it's something that it affects, or you look for much information on. I think what most people are aware of is more so these days is men's mental health walking groups, walking and talking. And there's some emotional literacy available. But I think it's not always the option for a lot of people, and I think the more it's advertised without it being in your face, the more it's advertised for people to just to say they can look somewhere or just talk to somebody would help more people come forward. And thank you. That's all that I need to say.
Thank you, Julia.
Thank you.
Councillor Hughes?
Yeah, I'd just like to say it's great to see there's more integrated work between health and social care beyond there. Both Alison and Joe give us a good understanding of that. But as Julia said, I do agree with Julia when she says about the hospital appointments. To get in to see a doctor is very hard. But that's not part of this report, but that's all I want to say. Thank you for the comprehensive answers that we had today. Thank you.
Anyone else got comments? I'd like to just echo what Councillor Hughes and other members have said, really, regarding the report. It's been very, very interesting, and I feel I've learnt a lot from having the report presented to us. Do we feel as a committee that we've considered the report properly and it has added value to our scrutiny role?
Yeah.
Okay, everyone in agreement? Okay. Oh, Alison, sorry, has got her hand up.
Yeah, I'd just like to thank Alex and Lisa for inviting me today. Really, I can't say it's enjoyed it, but it's been really interesting looking at the scrutiny and what our councillors do. So thank Alex and Lisa for inviting me today.
Thank you, Alison. Okay. So we can move on now then to the other report we're considering, and it's the safeguarding report. Are you taking this, Louise?
Yeah, happy to take the report, Chair. But just to say, I may have to pop out then. Apologies for that.
Yeah.
So agenda item 5, safeguarding update. This report provides members with a comprehensive update on safeguarding activity across both children and adult services, reflecting progress since the last report, outlining current performance, pressures and future priorities. Safeguarding remains a whole council responsibility and continues to be a core priority under the Social Service and Wellbeing Act 2014. It's positive to note that progress has been made in strengthening both corporate and operational safeguarding arrangements. Council has maintained a strong multi-agency approach through the Safeguarding Reference Group and the Cwmtaf Morgannwg Safeguarding Board, where Merthyr Tydfil continues to play a leadership role. The report highlights positive performance, preventative work, strengths, quality assurance and continued work. In summary, the report demonstrates the safeguarding arrangements in Merthyr are improving, with stronger systems, preventative work and enhanced partnership working, and sustaining this progress requires continued focus on performance, workforce development and responding to any increase in demand and complexity. So the recommendations of the report 2.1 is for the content of the report to be discussed and noted. Thank you, Chair.
Okay, thank you, Louise. Any officers wish to come in at this stage or not? Okay, move to questions then, please. Any questions? Councillor Ian Thomas?
Thank you, Chair. On page 27, there's a nice graph setting out the steady rise in special guardianship orders. Back in 2019, there were 4, and in 2022, there were 22. It's like a steady rise, as you can see on the graph. I was just wondering why are they so successful and doing so well?
Sorry, my camera's a bit slower than Councillor Thomas.
Gareth,
Yeah.
Gareth,
Yes?
can I got
Oh,
declined
yeah.
interest when you talk about SEO, sorry.
Okay, yeah, noted.
Sorry for that.
Okay, so from a local authority point of view, we've really promoted special guardianship orders, and since I've started, especially 2.5 coming up to 3 years ago. We're really developing our support services. We've recently recruited a senior practitioner within our Children Looked After team who specialises in special guardianship orders. We had the report recently in Scrutiny, I know, which went through special guardianship orders. Our plans are much more robust. I mean, we had 3 SGOs granted today, which has reduced our Children Looked After population by 3 today. So this is what we're doing, is we're promoting our SGOs to reduce our Children Looked After numbers, but in a safe way, because our plans are robust. Our support services are increasing, are becoming more robust. So yeah, it's a concerted effort. We are hoping for a number of other SGOs to be granted in the upcoming couple of months. It's a lot of work for the local authority to move from a care order to an SGO, but we think it's the right thing for the young person, and it's always about the right thing for the young person. We don't want children in care longer than they need to be, or coming into care when they shouldn't. So yeah, so those are the ones that were granted in the different quarters, and I know we've got our numbers are kind of stable. So people might say, oh, you've got an increasing number of SGOs, but you've got to remember that lots of young people are aging out at 18 as well. So our numbers kind of, going up, but not as much as as the numbers that we're actually being granted at the moment.
Thank you, Joanne. Thank you very much. Thank you, Chair.
Councillor Claire Jones.
Thank you, Chair. I've got to go back and forth. I'm having an issue with mod.gov yet again, so I've just had to email my questions over. I was looking at 3.18, the key priorities. So my first question was, given that the two key priorities from 23 to 26 plan are being carried forward into the 26-29, what specific performance data or lessons learned from the initial period justify continuing these exact priorities, please?
So the bit you're referring to is the safeguarding board information.
Yeah.
And obviously the priority for the board will always be to protect children and adults from abuse, neglect and any kinds of harm. So there's 2 groups within the so there's 2 subgroups that sit under the board. That's a quality assurance for adults and a quality assurance for children, and they look at all data from safeguarding. And they look at numbers going into the system. They look at, child practice reviews, adult practice reviews, and then all the data comes from there. So that's obviously what then we look at when we're just devising what the plan is and the priorities. So I'm not sure I've answered that very well, but prevention is always key. That's always one of the priorities, and that's information sharing that comes out of some of the SUSRs, the child and adult practice reviews. So that's the data we look at. From a local point of view, for Merthyr, we've got set data and PIs that we've got to respond to from Welsh Government point of view. So that's looking at numbers of referrals, number of strategy meetings, numbers of Section 47 referrals, and then obviously this equivalent for adult services. So that's all the data that we pull together.
Thank you. I'm having a bit of an issue with my questions at the moment. Chair, would you mind going to somebody else at the moment so I can try and work out what's going on with my mod.gov?
Yeah.
Because my
Any
questions
other
are gone.
members got questions? Okay. Okay. I'll carry on then, Claire. I've got a couple here, all right?
Thank you, Chair.
No problem. I've got to find my spot now. My first one was in relation to paragraph 3.5. obviously I attend when I can the safeguarding reference group. Are we quite happy now with the areas which attend and the level of attendance of that group?
So that was one of the things that was picked up in the audit that we had, that there were key areas that needs to be in attendance. And since we flagged that with those areas that were sometimes missing, they have been in attendance. So we've had the key players within that meeting. What we did do is, following the recommendations from the audit, is that we have looked at the membership, and there'll be certain areas that perhaps wouldn't be required to attend every meeting. But if they were particular topics we were talking about, you know, then we'd make sure that they were at that meeting. So the key agents, you know, like public protection, housing, education, social services, they are now represented every meeting. There's obviously member representation, like you said, Councillor Richards and yourself and Councillor Minette Vaux attends as well on those meetings. So, you know, we obviously, membership is something we'll look at, and the terms of reference will be reviewed on an annual basis, and that's part of that, the membership.
Thank you, Lisa. And similarly, it applies to the safeguarding, the Cwmtaf Morgannwg Safeguarding Board, which you chair. Are all agencies attending that board, or any issues there as far as you're aware?
I can't think off the top of my head of any issues we've had. We always have good attendance from key players around safeguarding. I think there's been an issue around perhaps, you know, something like education. Rather than have 3 education directors there, they tend to take it in turns. So they, you know, there is somebody represented from education, but I think we've revisited that now, and because we've got new directors sitting in Merthyr and RCT, what we've suggested is, as part of their induction, the 3 of them attend, and then we make a decision further down the line as to whether they do, like they do for the Children's Board or the regional partnership, they take it in turns.
Yeah, okay, thank you. My next question is a bit pedantic, really. I thought perhaps Councillor Thomas may have raised it. It's in relation to paragraph 4.2, the graph I'm referring to there. Could we
Which graph is that, Gavin?
No, paragraph 4.2.
No,
I know you've raised it in other areas previously, and I agree with you, really. The graph that's there now, it looks as if the 1 year is, well, a quarter or a third of what it is the year before.
I see you mean from the visualisation bit, but
Yes.
the numbers and all that different.
Yes.
Yeah, okay.
Yeah.
Well spot.
Just being pedantic, Lisa, but I think it gives a better impression, visual better impression, really.
Yeah, okay.
So, are you back with us, Claire, yet?
Sorry, I am, Chair, yeah.
Yes.
Thank you
give
very
way
much,
to
Chair.
you.
And
I give way to you.
No, thank you, because you asked 2 of my questions. Oh. I had a question about the graph and the first one you asked, so thank you so much. But out of curiosity, I've got one more question. 4.8, Lisa, when you give in the number of children's names on the Child Protection Register, right? I understand pre-births are excluded, because obviously, but how are the pre-births monitored then? Because there must be mothers who are expectant that will, how are they, I know they can't be on a child protection register because the child isn't born, but they must be on some form of alert.
Yeah, so we continue to, we'd have the child protection, so we'd have the child protection conference, but the names wouldn't go on. So we do all the work, the core groups, all the multi-agency working, but obviously until they're born, they can't physically be on the register, but all the work continues irrelevant of that.
Yeah, so you've got that, so that information is stored somewhere. It's just
they're there on the list, like on the register, but we just exclude them from the data because obviously things can happen until the young person's born.
Yeah, because my mind was just not absorbing that at the time. So thank you ever so much, Joe. That's really appreciated. And Chair, I'm finished now. Thank you ever so much.
Okay, thank you, Claire. Could I move on with a couple more questions to paragraph 4.5? my question is in relation to, it only gives stats, as I understand it, for the first 3 quarters of 24-25. Is there any reason why the whole here wasn't supplied in there?
Apologies, Councillor Richards. So what I've done is I've looked at last year's report and then put all the information for that into where we were. And obviously at the time we wrote the report, Q4 data wasn't available, and I should have double checked that.
Yeah.
But we can provide that if need be.
Okay, perhaps that'll be an action, if you don't mind, Lisa,
Yeah.
from this.
Okay.
Yeah.
Yeah.
So we got a full picture. And I think my graph criticism is in paragraph 417 as well.
Yeah, we'll note that and make sure we don't do it next time.
Yeah. And then my final one was in relation to, because I think we've covered it, you covered it off very, very clearly. It's in relation to paragraph 5.9. Give me a second, I've lost my thread. Yeah, are the dates correct? I think you got the same years twice, or I misread it. Previously, 34 SGOs were granted. Are you with me,
Yeah,
folks?
sorry. So it should have been
24,
24, 24,
yes,
and 25.
Yeah. That's great. Thanks. I just wanted clarity of that. And obviously the the minutes will reflect that then, really. Nothing else, no other questions on this other than to say it's a very, very comprehensive report. And I think that's reflected in the level of questioning from members here. Are there any other questions?
Sorry, Chair. I had one more question.
Yeah, no problem at all.
I'm sorry.
Yeah. And Councillor Jenkins, whenever you've got to go.
Okay.
That's noted. Thank you.
It was just something that caught my eye. It was page 22, paragraph 419. You say you carry out audits on numerous areas, and it was quite a long list of stuff that was audited, which would be a massive amount of work. I was just curious, is like 100% cover with your audit, or just a selection?
That's a selection. So we've got a quality assurance framework. Some of those audits are done by individuals within their relevant service areas. Sometimes we do it as a cohort, so every manager will take. So we do it very differently. So there's much more than that. Some of them we do as a region. So we'll look at individual sort of non-accidental injuries. We'll look at it as a region to see if there's any learning. So yeah, that's a snapshot of the audits that we do, because we don't learn unless we look into what we've done already. So it's really important. But it gets reviewed annually then, a quality audit framework, and updated, and we RAG rate it where we are, whether we completed, ongoing, and what ones need to be done, and it's updated every September.
Thank you, Joanne. Thank you very much.
Any further questions? We'll move on to comments. Any comments, please?
Just a quick comment, Chair.
Oh, Claire, Councillor Jones got her hand up a second. Yeah.
I'll wait for Councillor Thomas, that's fine.
I was just going to comment what a good report this is. It's massively detailed, and it must have been a hell of a lot of work to prepare it. So I just like to thank everybody involved.
Okay, thank you, Ian. Claire?
Yeah, I just want to reiterate what Councillor Thomas just said. It was a massive report. It's so thorough. Safeguarding is huge, and it's good to read something, you know, that our young people and adults are being safeguarded, because it does mean a lot to me, and I think that is the most important thing. And I think scrutinising that and asking those questions, and the way that Alex and Lisa and Joe answer, we know that Merthyr residents are being looked after, they are being safeguarded. So I would like to say thank you for the report, and thank you for everything you do, and pass that thanks on to all the work with you. So thank you. Thank you, Chair.
Thank you, Claire, and I'd just like to echo what Claire has said, really. I don't think there was any other comments, so I think the report has spoken for itself. It's added value to our committee here today, because we've learned a lot from it because of the depth of that report. So members agree that we've value added as a scrutiny committee by having the report with us? Yes.
Yeah.
Okay. Thank you all. Now, I don't know, is Councillor Hughes coming back in? I wasn't sure.
I'm not sure, Chair, he's just left.
No. Okay. He's not online at all anywhere, is he? No.
No, he's left.
Okay. So moving through the agenda, we now come on to the forward work programme, and obviously we've reached the end of our current cycle now. The dates for our next meeting will be confirmed in the annual general meeting of the council, which is being held next Wednesday, the 13th of May. I would say that Claire and I, oh, excuse me, met with the director this morning and discussed an outline, reports to go in the forward work programme, but we would welcome any suggestions from members, what they feel they would like to see on the forward work programme for the coming 12 months. So you're quite welcome to do that. Obviously, we better notify Councillor Hughes and Councillor David Isaac of that as well, really. Jane, could I just clarify from a committee clerk's point of view?
Yeah.
Will we have a meeting to discuss the forward work programme, or will it be at the first meeting, which I think is going to be in June?
Entirely up to you. I've prepared that outline following on from the meeting, so I can send that out to members so they can see what the outline is.
Yeah.
And then if you want to have a meeting, then we can have a Teams meeting and we can go through that in advance of the first meeting.
Yeah. Obviously, don't do that until after the AGM, because we don't know what the makeup of the committee is going to be until after the AGM. Okay?
Yeah, of course. I'll do it after the 13th.
Thank you. Thank you very much, Jane.
Okay.
Moving on the agenda. Scrutiny referrals, there are none. Feedback on scrutiny activity.